Two of the biggest uses of nuclear materials in medicine are diagnostic medical use and therapeutic medical use. Diagnostic medical use. This includes using radioactive uptake, dilution, excretion, imaging, or localization for diagnostic purposes. Radio-labeled drugs have metabolic or physiological properties which are used in the medical field to attain information. When the drug is given, radiation produced from sealed sources is used by diagnostic devices to take pictures of body parts or determine the density of tissues. Radiopharmaceuticals are drugs that contain radioactive materials called radioisotopes. They can be injected into a patient through a vein, taken by mouth, or placed in a body cavity. Once they are administered, they are monitored through specific imaging devices. Radioisotopes play a role in cancer therapy, but also in diagnosis.
For example, arsenic-74 and copper-64 are isotopes emitting positrons. A positron is an anti-electron. It has a mass of an electron but a positive charge. Because of this property, scanning devices can use gamma rays to locate brain tumors from outside the skull. For gaining information about thyroid function, the isotopes iodine-123 and iodine-131 are used as tracers in patients. While I-123 is harmless to thyroid cells, I-131 destroys thyroid cells. Both radioactive iodine forms, when given by mouth and pill or liquid form, emit radiation which can be detected by taking pictures of the size and location of the thyroid tissues.
Technetium-99m is the most widely used medical isotope. Molybdenum-99 was discovered by using a cyclotron or particle accelerator to bombard molybdenum with charged particles. From there, the Mo-99 decays at a half-life of 66 hours, becoming technetium-99m, the radioisotope that is used in medical tracers. Tc-99m has a short half-life of 6 hours, meaning 93.7% of it decays to Tc-99 in 24 hours, making it the perfect isotope for medical use.
The isotope is used as a tracer and has a 6-hour half-life. Once injected in a patient and reaching the myocardium, it distributes proportionally to the myocardial blood flow. Medical professionals can then use a specific instrument to capture the gamma rays emitted by the technetium-99 decay, allowing depiction of myocardial tissue in the blood. This imaging technique is very important because it pinpoints dead myocardial tissue, which could lead to cardiac problems later on.
40% of the world's MO is supplied by MDS Mordion, a Canadian company, and 25% from Mallinckrodt Pharmaceuticals, an Irish company, with the majority of its creation being completed at two different reactor locations, the NRU in Canada and HFR in Netherlands.
Therapeutic medical use is the biggest way we use radioactive material in medicine. This is usually used to deliver therapeutic doses of radiation to specific tissues or area of the body to relieve pain. For example, in teletherapy, an intense beam of radiation is focused on the target tissue. A device that is often used is called the gamma knife, which uses a collimating helmet to focus radiation from numerous cobalt-60 sources to a specific location deep within brain or heart tissue. Doctors also use radioactive iodine therapy, in which small amounts of the isotope iodine-131 are used to treat cancer and other medical conditions most commonly affecting the thyroid gland. In addition to iodine-131's use for diagnosis of problems in the thyroid, it's also given to combat hypothyroidism. It's used to destroy overactive thyroid tissue or shrink thyroid glands that are causing problems because of their size. Symptoms following the procedure may include mild neck pain, but this can be treated with over-the-counter painkillers. Another therapy is radioimmunotherapy. In the lab, molecules called monoclonal antibodies are produced and are paired with a radiotracer. When this is injected into the patient's bloodstream, these antibodies travel and bind to cancer cells, giving the tumor a direct dose of radiation. Today, the agent used is yttrium-90.
Brachytherapy is also a treatment of cancer. Radioactive materials such as isotopes, such as iodine-125 and strontium-89, is sealed inside a seed or pellet and placed inside the body in or near a tumor. These are permanent, and after several months, the radioactive level of the seed diminishes because of radioactive decay.